Hi everyone, welcome back. Moving on to Delirium assessment using an assessment tool called CAM. CAM is a short form for Confusion Assessment Method score. So there are many screening tools available to assess delirium, which is Confusion Assessment Method CAM, Confusion Assessment Method for ICU, CAM ICU, Richmond Agitation Sedation Scale, RAS, Nealon and Champagne Confusion Scale, NECAM. Today, we will focus on Confusion Assessment Method, CAM. It is a screening tool for delirium. This is a summary of the tool. The diagnosis of delirium by CAM requires the presence of both features A and B. A is acute onset and fluctuating course. Is there evidence of an acute change in mental status from patient baseline? Does the abnormal behavior come and go, fluctuate during the day, increase or decrease in severity? In B, which is inattention, questions to ponder: does the patient have difficulty focusing attention, become easily distracted, or have difficulty keeping track of what is said? So A and B is a must, and the presence of either feature C or D. C is disorganized thinking. Is the patient's thinking disorganized, incoherent? For example, does the patient have rambling speech, irrelevant conversation, unpredictable switching of subjects, or unclear or illogical flow of ideas? For D component, which is altered level of consciousness, overall, what is the patient's level of consciousness? Alert, normal, vigilant, hyper-alert, lethargic, drowsy but easily aroused, stuporous, difficult to arouse, and comatose, unrousable. You can choose either one of these. So, screening instrument. Assessment tools are helpful to directly test the patient's cognitive performance level. However, results vary with the patient's age, educational level, ethnicity, and language. It is important for the person using the assessment tool to know the patient's baseline mental status. Each type of assessment has its own advantages and disadvantages. Determining the most appropriate assessment tool is largely based on the psychometrics of the tool, feasibility of the scale, and patient's amenability to being tested, the clinical setting, and the need for a diagnostic tool versus a monitoring tool. So, Confusion Assessment Method is recommended as delirium screening instrument and diagnostic aid. Others can be used to provide information and completion of the CAM, such as mini mental status examination and delirium symptom interview. Mini mental status examinations, such as MMSE, may be affected when patient is delirious. However, it should be a serial assessment, so if there is any difference, it can be monitored. To measure the severity of delirium or to monitor its cause, delirium rating scale or delirium index can be used. To help assess alcohol withdrawal delirium, the Clinical Institute Withdrawal Assessment for Alcohol, GWA-AR, can be used. To help collect collateral information and baseline cognitive impairment, the Informant Questionnaire on Cognitive Decline in the Elderly can also be used. The results from screening tools must be interpreted within a clinical context and do not in themselves result in a diagnosis of delirium. CAM score cannot result in a diagnosis of delirium, but clinical presentation and clinical interpretation is far more important than the CAM score on its own. In more complex cases, practitioners should consider additional measures to evaluate neurocognitive status and referral to a specialist. In more complex cases, practitioners should also consider the underlying cause of the delirium.